charity organisations in Croydon that are hopefully helping to deal with health inequalities and amongst other things that are affecting our BB communities in Croydon.
Thank you. I'm in the department. I'm the Corporate Director for Adult Social Care and Health here in Croydon. My role, I work with all adults from the age of, well, from transitions from 14 up until end of life, so all hospital discharge, any social work teams, any provider services, dementia units, the remit, and I work very closely in partnership with everybody sitting on this panel today.
Hi everybody, I'm Sarah Burns, I'm Director of Communities for Croydon Voluntary Action. My role is everything around partnerships and networking, serving the whole of the voluntary and community sector, including residents, so right from active citizens to very big charities, bringing people together to find that kind of common purpose. I obviously rolled it, sorry. Thank you. Hello? It's all right now.
Yeah, you might. That's it. Just with it. Start. Just.
I think that was my cue to wrap it up anyway. Lovely to be here.
Thanks, Sarah. Good evening, everybody. My name is Matthew Kershaw, and I am Chief Executive of Croydon Health Services. So we look after the hospital and the community services. So that's district nurses, health visitors, school nurseries, etc. Across the whole of Croydon. But I'm also something called the place-based lead for health, which means I sort of oversee the other parts of the health service that connect it to Croydon. So that's primary care, but also connection to our colleagues at SLAM who run mental health services in the borough. So I have a role to sort of try and connect up all those various bits of the health service as they affect people here in the fantastic rural Croydon.
Okay, thank you very much. Before I start, are there any more questions that I could take in at all? Yes? I'm going to start making them off if not. Okay. Right, well I'll start with the one that was handed in. I'm not quite sure who could help me with this one, but the question is about, can somebody help getting some swimming pool to accommodate people who have visual impairments? Somebody's clearly having difficulty managing to go swimming because of a visual impairment. Anybody got any sense of that?
So if it's somebody in the room here tonight, then they can come and speak to me, because I'd be happy to take from that individual. But we have got a sensory impairment team here in Croydon that actually will support. We'll do an assessment and come out and see you, and there will be swimming pools that will facilitate that. So I think, we have got a really good sensory impairment team here working within in the council, and if the person is in the room, please come and speak to me afterwards, and then we'll have that conversation, because
that's what I say. Section. Just as things amazing, distinctly decide. So articulate it's the partnership.
Can I just add as well, I know there are a few councillors in the room as well. So if there is an issue that we're to the school board, and if it is in their own street, we can reach out to them as well, and they can apply for it.
Because I really suffer to report and we contact other people who wish to have because it's with definitely I will go to this it's at the time they can get some walk out then I'll be my phone. Can you because also being healthy is not only going to the GP, it's really important to know how you good experience, but also the healthy kinds of things is actually
And I'm glad to hear that the sensory impairment team is excellent. I'm glad to hear the sensory impairment team is excellent and really good. And also, actually, there is about disability and accessibility to services. and actually as a public baths, you should be able to, there shouldn't be a barrier. It's big and it's not the council or health, but let's talk, I think, afterwards.
Yeah, thank you so much.
Okay, that's really helpful, thank you. It strikes me that there might be a need for some training as well, mightn't there, for the staff, if they're not maybe as sensitive as they should be to people's particular needs. Okay, so ordinarily I'm swamped with questions. Tonight I think people probably feel a bit tired and haven't been able to put their thoughts together. So I'm going to wander around the tables and pick on people. I'm sorry about this. No, we've got to get the questions from someone. Yeah, this one.
Good evening, everyone. My name is Sylvia Wachukwukian from Wellbeing UCIC. When we had the discussion on inequalities, one of the things that came up was the many structures that exist and how do those structures work together to ensure that their missions are accomplished. So when Matthew talked about his role and place and how he tries to go. I know we can spend the whole night, but if you can just give us an idea as to how we try to pull all these key areas together so that people understand, because sometimes I look at the video and I say, my God, how does it work? How does it, things go together? Thank you.
Thank you very much, Sylvia. I've been to some of Sylvia's events. Anybody else been amazing? You must also be able to say thank you for what you're doing. What I'm trying to do in my role with trying to make those connections is to try to make sure that for the people we serve here in Croydon, that some of the gaps between those services are a bit smaller or don't exist. So how it works between, for example, what happens in the hospital. We're trying to discharge a patient and they might need ongoing care from a district nurse, then that's all part of my role to make sure that works seamlessly as much as is possible. If I need to work some of the health team with some of the next team in social care to try and help support that discharge, they might be having domiciliary care once they get home, then we try and make that connection on a day-to-day basis between the staff in the hospital and the staff in social care. We try and bring those people together and get them to work hand in hand. Same thing between what happens if you go see a GP. We try and make the connection to the hospital as close as possible so things don't get lost in between the GP and the hospital if a patient is referred for an outpatient appointment, for example. So all the things we're trying to do is to try and make the various bits of the health service and social care come closer and closer together. That's also true for a connection between the services that I run and that others on the panel run and the voluntary sector. So I spend quite a lot of my time talking to colleagues in the voluntary sector to try and make sure that if there are services that they can help us provide, connections they can help us make with the community here in Croydon, that we're listening to that and we're trying to be active and part of the conversation that happens in Croydon every day, which is why I've come to events such as yours, Sylvia, to try and make a connection with people and understand what things are working well, what things aren't working well, what we can do to make things better. So my job is to part of my job is to try and make those connections as strong and as close together so that it helps us run better, more connected services for people that we are trying to look after here in Croydon.
So, Sylvia, you were part of my group, so I can speak directly to what we were talking about, which was the structural inequality, wasn't it? We were talking about dependency culture and how, actually all of us have something to give to each other, to our friends, to our neighbours. We want to be able to tap into the strengths in the room, and there's certainly lots of them, because I know some of you, like Sylvia and Lucy, doing phenomenal work in the community and reaching really deep into some of the harshest end of inequalities. So it's very much about making sure that we're hearing these voices and we're tapping into that reach, and we're encouraging people to follow the passions and be part of the solution. It isn't one service, it isn't many services, it's all of us. It's all the people, all the assets that we have pulling in that direction. So really structurally it's about trying to change the ways that we've become kind of a bit dependent, to think about how we can release our potential, how we can tap into the opportunities, into the connections that we all bring, the old-fashioned neighbourliness. It takes a village to raise a child, as we discussed on our table, and how important that is, that we provide that kind of encouragement for people to play their full role and actually gain the health benefit of doing so, because it's a really important thing to give in order to actually stay healthy and well. So we spoke a bit about that, didn't we? And I think a lot of the work that we do is about providing that structure through partnership work, through our local community partnerships. One of the things that we're doing is trying to create community hubs, so spaces across Croydon in all different, what we'd like to see is community hubs in every neighbourhood, so existing spaces where people can go to and they can meet other neighbours, other people that, like them, may know a little bit more about what's happening locally, but certainly they can be listened to and think about their next step for better health. It might be a connection to a service, and it might be that they've got something to set up themselves, some kind of gap or peer support that's really important. So there's lots of ways that everybody can feed in, and really this is about local democracy in many respects. It's being able to everybody to play a full part, because our biggest assets are our people. But it's important as well that we link up with our services, and so when people do need them, they're there, they're strong, and they're ready to be to meet people who need it most. So it's all about that linking up, and I think we're trying to do that through a number of ways. Those local community partnerships and those community hubs are central to that. Thank you.
Happy to talk.
Are there any other questions? Oh, there's one here. Hang on a minute. Okay. Right. I'm not sure. Okay, I'm going to read this out and see who wants to have a go at it. We'll start to pretend. I think recent surveys by Ipsos support.
My handwriting is.
It is. Yeah.
Sorry. Recent research by Ipsos has suggested public are supportive of preventative and public health intervention.
I just wondered where Croydon was focused around that. Because obviously there's a lot of focus on people who are ill, but on the preventative and particularly public health interventions.
Thank you, Gordon. The work on prevention and public health, I think, is a responsibility, obviously, for the Public Health Director, which we have one here in Croydon, although changing personnel. But I think it's a wrong thing to suggest that is the only person who has a part to play in this. So, for example, in our hospital, then there's lots of stuff that we're doing to try to respond to the needs that people have. So if they're ill, we try and fix them. But there's also a job that some of my doctors and nurses are taking very seriously to try and help improve prevention. That might be after an initial illness. There may be, as we're doing increasingly, trying to connect up with, for example, schools and try and have a look at how we can improve education and information to young people who can then perhaps live a bit of a healthier life from the start, which prevents them getting issues such as perhaps diabetes, which is a big deal here in Croydon. So I think public health prevention is an important thing for the people whose job it specifically is, but it's also equally important for everybody else, and that's what we're trying to do. We're trying to build in public health a bit of a broader range of people who are involved so that we can all do a little bit to help become a little bit healthier. And that's something that a lot of professionals can do, as I've said, but it's also something that people in this room can also help with. And I know there's lots of people involved in various different things here, and all those little bits I think can make if you add it all together, quite a big difference in terms of trying to make people a little bit healthier, as well as the health service being there to help fix people when obviously they have got ill or they've got long-term conditions. So I think it's a bit of a collective effort. Now the other quick thing to say is the 10-year plan that the NHS is looking at the moment, and we'll no doubt be talking about and trying to get some input from Healthwatch on. One of the streams of that is about trying to improve prevention rather than just looking at curing patients or treating patients. So it's something that very much is going to be of the moment, and there's lots of discussion going on at the moment. And one of the things that I've been trying to say in some of those groups is let's try and keep some of these messages straightforward, simple and focused. There's a bit of a risk you bombard people with the 100 things they have to do every day to keep themselves healthy. That's not a way I think of engaging people. Simple messages that are focused, that people can actually deal with, I think are much better, and that's something that we will try and do.
Just list a couple of things as well on public health. It's over the lifespan, so housing plays a huge part in prevention. People, where they live, how they live, education, work, where we work, where we are employed, and how we keep healthy. So I think there's a huge amount of work going on, and it's not all about making people, curing people. It's actually people with long-term conditions, how do they remain healthy and improve their life living with a long-term condition. So public health has got a huge part to play, but I think we've all got a part to play in it.
No.
Just wanted to add to it as well. Hugely important question. Thanks for asking it, Gordon. We need, to have that focus on health prevention. I think it's been in strategies for donkey's years. I don't think we're there and fully realising, what we should be doing in terms of health prevention. I think there's, a great desire. In truth, it becomes quite problematic when it's faced against acute care, and conversations can be quite focused around demonstrating the impact of prevention, which for those of us involved in demonstrating the impact of prevention, that's a tough ask. But we are doing all we can in communities to try and put in place evaluation, monitoring and learning systems to be able to really show the impact that work happens, that preventative work does. And it's a difficult ask, and we really do need some brave interventions to look at how we can transform through prevention.
Perhaps. Informed.
In Croydon, we quite rightly are focusing on strengths-based approaches, asset-based approaches. So, my question to the panel is, please could you give us an example or examples of strengths or asset-based approaches? And I'm interested in what was the strength that was identified and how that was used to meet an outcome.
So one of the things that I'd say is a strength in Croydon, and I've worked in loads of places around the country. I've worked for the health service for quite a long time. One of the things that I think stands out in Croydon is partnership working, and that was a massive strength, as demonstrated, I think, by the gathering tonight. And that partnership working has definitely made us, in terms of outcomes, work closer together. I was trying to describe an answer to Sylvia's question, to try and connect up some of our services, to try and make sure we're in partnership with local communities, so we're not just developing and implementing and providing services that perhaps people need but would like it in a different way. And I think one of the strengths of Croydon is that partnership approach, where we're trying to work together a bit as a group of professional organisations, but also trying to work closely with communities to try and listen to what people want and respond and make our services fit what people need a bit closer than they would do if we didn't have that partnership approach. So for me, one of the strengths is that partnership approach.
I would just continue with what Matthew was saying. So, ourselves, Credit Community Forum, mine in Croydon, NHS, we've created like 2 community centres, which is based in the Whitby Centre. So lucky enough, I went in and saw the manager in the Croydon Health and Wellbeing space this week, which is that we had over 600 people actually coming to that building in 1 month. Now, when we talk about 12 months ago, well, I've been talking between 100 and 150, but now talking over 600 people now accessing those services. The good thing about that as well is we're now bringing Healthwatch as well. So both those centres, well, the first one, the Wellness Centre, it was actually the Healthwatch who actually helped us actually come up with that idea and what they're paying for that. So that I could go on the centre to funders, which then funded us 5 years ago. And so when we talk about partnership and examples, that's the kind of stuff we really work doing as well. So it's making sure that our partners are working together. But talking about sustainability as well, we have to make sure that those projects start with our sustainability as well. So it's good enough just having the projects, what happens about when the money runs out. Are we just going to close the doors? Are we going to be sustainable? So lucky enough, both those projects should be sustainable, but we precisely need it from the NHS and our partners inside the stream as well. Yeah.
And I just think I'm going to use the example. Look, so actually, to be able to walk in, because there's no appointments needed, it's about taking control. So if it was me and I could just walk into the Whitgift Centre, go in and speak to somebody and get access to somebody that would help me with an issue, it's about me taking control. And it's sort of saying, not about being, come and look at me and sort of saying what's wrong with me, but actually there's lots I can do, what's strong in my life, but actually where I've got a problem and I could come out and search for some help within the centre. Maybe it would be around maximum benefits, or I'm struggling with anxiety, I'm struggling with my mental health, that I could access someone straight away, or that they will support me in where to go and help me move forward. And I think, we could pick out many individuals. I'm sure, Andrew, you could pick out many people that you've helped and that you could see that have taken control themselves. And I think that is the strength-based practice, and it's here at home where I live. So it's in my home place that I can get help with well.
I think in terms of outcomes, I'd look at keeping well, keeping independent. Andrew and I run strength-based training courses together, actually, and as a shameless plug. And so we'll give you the dates for that, Gordon, in case anybody wants to attend.
I've been on it.
Oh, marvellous.
Yes, I would recommend it.
Wonderful, you've heard it here. So in terms of that, one of the biggest things in terms of outcomes I think we look at is that connection in order to keep well, and the importance of actually having friendships, having people that care about you and look out for you, around you, really keeps you well. There's a lot of research around that, and I think most of us know in ourselves that that's what keeps us well, our relationships. And I think, for me, we take that into our work in the strength-based approach, because in order, particularly with health inequalities, in order to access any kind of support, you need to trust that you're going to be heard, you're going to be seen, that you need to trust who you're going to support too. And that's relational. It's about having those relationships, which is why the partnerships are so important, but being able to access people who are consistent, who are there in their communities, who care, who will make sure that they're connecting you with somebody who will see it through. That's a big part of our work. Thank you.
Can I just add something? It's great.
Well, as well-being, we are implementing a project that we call the Wellness Unchecked Meetup. It's one of the projects that have come up from the Croydon Centre East locality, and our strength are the people, our elderly friends. The elderly people who we are trying to support, they have now become the strength of the project. So we are celebrating our first anniversary on Thursday, and if you want to appreciate strength, come to that event. It's at the Ashburton Park Hall, and it's from 12 o'clock to 3 o'clock. And so you will see the elderly people taking the lead and doing things for the project. We are not doing things for or to them, but they have, with their strength, kept the project alive. Thank you.
Thank you, thanks. And thanks, Sylvia, for the reminder. I think you do some wonderful work with the Londoners. It's really good to see people taking responsibility for their own health and well-being, isn't it? Yeah, that's good. Thank you. I've had a question here, and I'm thinking that I'll expand it a bit if you don't mind. We've heard about outcomes, we've heard about effectiveness and how difficult it can be to measure the effectiveness of the work that's being done. And we've heard about prevention and how we're trying to help people to remain fit and healthy and independent for as long as possible. So the question really is for all of the panel in turn, and you can decide who's going to go first. But it's about, does your organisation have a research strategy? And what efforts do you make to check that the services that you provide or the initiatives that you might be developing have actually got a research base that shows that it's worth investing public money in those services? So, we'd like to start.
Nice one. So, no, we don't have a research strategy, but we are doing research projects. So it's just, we say research strategy, so I want to go back and think about that. But 3 of the research projects that we're currently doing is awareness stroke within the Black community, maternity within the Black community, and also around EDI and research in hospitals and trust within hospitals. So that's just 3 of equality, diversity, and inclusion as well within hospitals. So we've got, I think there's another research project about to start as well. So we've got 3 research projects starting. We'll go back into with our research strategy and see how that's included in the research in the companies like us.
Yes, so all of our work that we do is evaluated. So it's underpinned by, so this research, but it's research done by others that implement the underpinned work that we're doing. So the enablement article is very much embedded in research, and it's evaluated here in Croydon to see the outcomes, see if it's working, and how we can move and change things and really make it better. And a lot of our community-based work, so our locality work and the ICM Plus, and it's on evidence-based, and we haven't just made it up. We may have personalised it to Croydon, but there is evidence and it's evaluated. So we look at it and we evaluate it and see what difference it's making. So, Healthwatch will come in and do some surveys, or they'll come in and do work to, you've done the AAE, you've done lots of, you've done the asylum seeking work that you've done, and also we have scrutiny, so we have health and care scrutiny, so we are asked questions from the people that's been elected here for you in Croydon of the work that we're doing here in Croydon, and what does it mean for actually for the residents of Croydon, and how it's happening and working for these working.
So we've got some rich research across the voluntary sector, of course. We've got some wonderful research done by some of our larger organisations like Mandate, UK, etc. But what we do in the local community partnerships is bring that kind of research together and the strategic alignment together. So for any of you that haven't been to a local community partnership, what we do there is we bring residents together, we bring community groups together, Just as an idea, we've got over 600 voluntary community organisations involved. They come together and look at priorities. It would be no surprise those priorities are things like mental health, food and poverty, younger people, later life. The kind of key priorities that we know are issues across the borough. But what we're doing is doing a bit of co-production there. In some areas we've done surveys about what's important to, for instance, local people, young people, hearing from young people about what it is they need to keep well, to feel safe, to feel part of and empowered within their community. These deep dives in different areas in terms of research, but we're also really mindful that there's some fantastic organisations that have some research as well, so we're looking at that strategic alignment and trying to bring it together. It's not an easy task because there's a lot of fantastic organisations and people doing some brilliant work in Croydon, but it's really important that we pull it together and find the gaps between us and focus our energies where there are those gaps, because we know there are plenty of them as well. Thanks.
Thank you for the question, and the short answer is yes, we do have a research strategy. We have a research department at the Trust, and we're doing research into new techniques, and might be supporting a drug trial that's an international or national trial that we'll be doing here in Croydon, giving an opportunity and a benefit to local people as part of that trial. We're also doing research projects into some of the things that we've developed. Are these the right ways of working? So we're doing a big piece of work recently on virtual ward, where we contribute to some research about is that having a benefit. That's where we're perhaps people who would have been in hospital a year or two ago now can be discharged a bit quicker and supported at home with a nurse going in and seeing that patient, or the use of technology to sort of check their vital signs so that they can stay at home and not come into hospital. We're doing research into whether that's effective. So there's quite a lot of work that we're doing underneath the research strategy led by our research department. We also do quite a lot of clinical audit, so checking that we're doing what we said we would do and we're doing it properly, and we're using the results of that to inform how we might change services going forward. So there's quite a lot of that going on in the hospital and in community services here in Croydon.
Thanks. Thank you very much. Is there anything from anybody else in the audience today? Sorry?
I would think you got mine to do a hoarding project, and you know everybody says that.
Let's then use the microscope so you can do this.
Mind used to have a hoarding project, and the funding was pulled, so now there isn't a hoarding project. So I phoned around. There is like a national hoarding project, and they sort of pass you on to other people, but it's not in the area. So where's the support for the people? Remember, a lot of people are passing away. There was sandwich carers, the parents that passed away, so there's a lot of stuff. I went through that myself, like I had to clear my mum and dad's house very, very quickly and end up in mine. Luckily I was able to, was people used to do the front room where they collect a lot of ornaments and stuff, you know what I mean? So it's a cultural thing. And I was left with a lot of stuff for about 4 years in my dining area. And I tried to run that mind, and they were going to give me a body, and then by the time, I feel like they're falling in from that. And then they said their funding was pulled and it's not there. So where is that? Because there's a lot of gaps. I'm not going to pick on anybody in particular, but I can give you a case study of certain things where my son goes from his bedroom to the street, from the street to the police station, from the police station to a prison, from a prison to priory, and then to hospital. Now, in all of that, there wasn't a lot of support to me. I had to fight 3 psychiatrists, and because he lived in Croydon, but it was in Enfield, there wasn't a lot of support. So a lot of this is glossy language, but when it comes down to the practical support we're talking about, and don't tell me go to a solicitor, because at the end of the day, they could only send you out to prison, and the judge said, no, you're not going to prison because he's autistic, and they treat him badly. Because when we're talking about cultural things, everyone wants to say, oh, black people and mental health, there isn't actually something that's actually helping them get out of there. and there's a misuse of the Mental Health Act. So at the end of the day, if we're going to talk about things, and let's look at some case studies, because I want to prove to me that you're getting all that money and there are these case studies that you're actually helping people practically. Because if you're not, then it's just glossy language, isn't it?
Absolutely.
Yeah, quite agree. And I think the learning has to come through change stories. A lot of the time, we spend a lot of time focus on celebrating what's working well and not looking at what's not working well. And there's a lot of learning. I'm not going to comment on your story other than to say, yeah, what a story, and it needs looking at and working through. And a lot needs to happen to properly address those cultural inequalities that you're talking about, and also the learning disability that's there too.
The only other thing I'd add, I agree with Sarah completely, is we know that mental health provision at the moment is not where we want it to be. There's more demand than there is access to the service, that is true, and that is something that the health service across the whole of South West London is looking to change, trying to invest more money and more resources into mental health, both from a child perspective and from an adult's perspective. Now, has that solved the issues yet? No, it hasn't. In your case, clearly demonstrates that it hasn't. But that's what people are trying to do. They're trying to invest more in mental health services throughout the whole of the pathway to try to address some of these issues. And it's something that I know will be a commitment for a number of years, because it's not something that we can just say, well, we'll just change something tomorrow and all of those issues go away. They won't. There's a significant need, and we're not always able to respond as quickly as we'd like or in the way that people need at this moment, and that's something that absolutely is and will remain a priority to try to address some of the issues like those that you've identified. So I can't solve your issue.
I know the other man is in a mental institution. We went there on a 28-day assessment. He's in there 4 years later.
Yeah, I mean, obviously I'm not going to be able to talk about individual cases. I don't know about it. But
that's why you'll see that people have been there virtual years. Who's challenging that?
Yeah.
People on injections for virtual years that can't work really. And that's not in that community. That's the thing people want to see challenged. I don't want to hear no more about, we're doing this. And no, these are things being challenged. And if they're not being challenged, it's waste of time. You can't be a monument to all organisation back out of concerned.
And that's why we come to events like this to hear what people say, so we can then pick those issues up as part of the overall work that's being done. Because it's not like there isn't work being done to try to address those mental health issues. There are, and I will happily sort of reference the points that you're making in the conversations with the people who are actually discussing and deciding and try and make those improvements going forward. So we will absolutely continue to try to do that.
We're still not waiting.
Okay,
Thank you very much for telling us about that. I'm sorry, my voice is going, but I think it's very brave to speak up about a personal situation that you know of in your community. And I think it's very unfortunate that it's not being dealt with in the way that we would like it to be. It's something that I think Healthwatch Croydon needs to think about. One of the opportunities we have through these annual meetings and other times when we meet with people is to find out what's of concern to people in the community, to help us to think about what can we do to raise these issues with the authorities. It feels as though the situation, I don't mean the personal situation, but the lack of funding, the issues that are affecting services in this way are well known from what Matthew is saying and from what Andrew is intimating to me as well. But it clearly isn't satisfactory, is it? You know, it's not good enough for people to be in those situations. So, you know, can we talk, Gordon, afterwards about this and think about whether we can do something to help to raise these issues? Yeah, thank you, thanks. Okay. Wow, we seem to have run out of time. I was going to ask, and I forgot earlier, Professor Sorry, I'm so tired at the moment. Whether you'd like to be able to speak to us, yeah, thank you. Professor Jamie, I'm sorry.
I'm
The time.
speaking to people who are away from the professions. And I guess the plans to make it more effective and great.
That's a good point, actually. Yeah.
There's plenty of opportunity. I mean, just to say, we've obviously booked until 8. I know, appreciate we've got simple refreshments. You will really work very hard today. Please stay, enjoy the refreshments, and maybe get a chance to talk with further next. So, there's no rush to me, although I appreciate people that have places to go.
Exactly. All right, well, thanks anyway, and I'm sorry we've used up your time. But thank you everybody for coming tonight. It's been really good to hear from everyone. And we will, please do leave the information behind that you've been working on, and we will turn it into a report. If you want to let us have your email